Welcome back. COVID cases are rising and they are now at a 5-month high. COVID cases are currently at the highest since October 28 last year. And the COVID cases have in fact crossed 2,000 cases. If we tell you about the numbers, the major surge in COVID cases is coming from 3 states, Maharashtra, Kerala, Karnataka and Gujarat as well. These 4 states are contributing to COVID cases the most. And the COVID positivity rate currently stands at 1.51%, which is up from 1.7% that was reported just a few days ago. So the COVID positivity rate is also gradually increasing. This means that out of every 100 tests being conducted, more than one person is testing positive for the coronavirus. The death count is also rising. 4 deaths have been reported in the last 24 hours, which is up from the average of 1 or 2 deaths that were being reported earlier in the months of January and February. That graph shows you how COVID cases have been rising over the last few days and how the COVID cases are now at the highest level since October 28th last year. The positivity rate is jumping to 1.5% from 1% a week ago. And along with that, there's also a marginal uptick that we are seeing in the number of deaths as well. 4 new COVID deaths reported, up from the average of 1 to 2 deaths that were being reported in the months of January and February. So there might be several questions on your mind. Is there a new COVID wave that we're looking at? Are there new symptoms to be worried about? Is there a new COVID variant that might be driving this surge in cases? So for all of those questions, we are being joined by doctors who will answer your questions and who will clear all your doubts about the rising COVID cases. We have Dr. Rajesh Parekh, who is a director at medical research at Jaslok Hospital in Mumbai. He's also the author of the vaccine book for COVID-19. We also have Dr. Vivek Nangia, who's a principal director and head of pulmonology at Max Hospital. And we also have these doctors joining us. Thanks very much, doctors, for joining us on this special discussion. And Dr. Rajesh Parekh, if I can come to you first, are you seeing an increase in the number of hospitalizations, people coming up with COVID cases, considering that Maharashtra is one of the states that's driving the surge this time as well? So while cases are at a 5-month high, are hospitalizations increasing or are cases mostly stable?
Oh, they are certainly increasing, and I'm sure my colleagues across the country will validate that in their institutions. The number of cases, as you've pointed out, have increased exponentially, and therefore it is to be expected that there would be, if not a concomitant, at least some increase in hospitalization. We're clearly seeing that.
Right. And if I can get that same question to you, Dr. Vivek Nangia, as doctors pointing out that there is some increase in the COVID hospital admissions. But are there serious cases that you're seeing, or the cases remain to be mild? Are there hospital admissions in ICUs increasing? Are there patients who require ventilators, or are the symptoms this time considerably mild compared to the previous few waves?
Yeah, thank you for asking me this question. So I would say luckily so far, of course, while the number of cases of COVID are increasing even in Delhi NCR, but not many people are requiring hospitalization. The people who are requiring hospitalization are those who are in the high risk group. Usually those who are elders, those who have a comorbidity like diabetes, hypertension, heart disease, lung disease, liver disease, kidney disease, or a underlying cancer, or are immunosuppressed. Those are the people who are at risk, hugely at risk right now. Otherwise, most others are only developing a mild kind of an illness, where fever, cough, cold, sore throat, body aches are lasting for about 2 to 3 days, and then they're settling down. On the contrary, people who develop H3N2 and other influenza type of infections, they are having prolonged symptoms. There, the symptoms are lasting for nearly 5 to 7 days. And the cough in some of them, along with wheezing in the chest, is lasting for even longer, for about 2 to 3 weeks in many patients. So as far as COVID is concerned, I feel it's still a mild illness, especially in the non-high risk population. But of course, we need to be careful and cautious and need to take all possible precautions from now on itself.
Right, of course, important to take those precautions. Many of us are not wearing our masks anymore. Many people have missed their vaccination doses as well, given that COVID cases were falling. But now they're rising again. And we also have callers from across the country who have called us with their questions. Suhani is joining us from the national capital. And Suhani, go ahead with your question to the doctors.
Yeah, hi. Good afternoon, doctor. So I wanted to ask, is there any new wave of COVID coming up?
Dr. Nangia, if we can take that question with you. Is there any new COVID wave? I think that's a question on most minds currently.
So, Hari, basically what we need to understand is that this is a virus which has entered in our ecosystem and is going to stay with us. The numbers can go up and down. Whether to call it a wave or not to call it a wave is more of an epidemiological question and more of a theoretical question. What we have to understand is that yes, the numbers are rising and we need to be careful.
Right. Okay. Thanks very much, Sohani, for joining us and for that question. I think that's a pertinent question that all of us ask every time COVID cases start going up. But that question doesn't seem to have a clear yes or no for now. We also have Jaideep joining us from Mumbai. Jaideep, if you can hear me right now, what's your question to our doctors?
Good afternoon, doctors. My question is, in Mumbai, we are seeing a lot of flu cases, seasonal flu that is. Is there any way to differentiate seasonal flu from COVID? Do we need to worry about COVID when we get seasonal flu?
Right. If you could please answer that question.
Is that question to me?
Yes. Yes, Dr. Parekh.
Okay, Jaideep, there's an interesting pattern in the distribution so far. Delhi questions go to Delhi and Mumbai questions come to the person in Mumbai. There is a way to differentiate, but it's not practical. The surest way to differentiate is not necessarily in a clinical manner, though that can help to some degree, but with the RT-PCR test. So, Jaideep, the RT-PCR test has become very sophisticated now relative to what it was earlier. It can detect not just COVID, but about 9 other viruses, including H3N2. So that test will help in deciding what it is, one way or the other. On the other hand, there's considerable overlap in the symptoms between H3N2 and COVID. And what doesn't change, however, is by and large, again, I'm just talking generally, of course, the medication, if given in the first 5 days, is very different for these 2 illnesses. But as Dr. Nangia pointed out to us, most of the cases are mild, do not warrant a specific antiviral medication. So from that point of view, it is indeed somewhat challenging to differentiate between the two. And both are spreading rapidly, but the precautions are the same. The management is more or less the same.
Right. So, of course, that's a very important question, given that the COVID cases are rising when influenza cases are already spreading across the country and many people are having that incessant cough and cold. We have another caller joining us, Piali, who's joining us from Mumbai. Piali, thanks very much for joining us. What's your question for us?
Yeah, good afternoon, everybody. I am from Mumbai and just want to have some basic ideas. Like, I have been vaccinated with both the doses, COVID-19 doses, but with the upcoming surge with in the COVID cases, do I need to have the booster dose? Because I'm pretty worried about it, because I'm a patient of a thyroid patient, as well as I am a prospective. Sorry. Hello.
Right. Piali, yeah, your question, we've heard that loud and clear. Dr. Vivek Nangia, if you could please take that question.
Yeah, so Piali, thank you for asking that question. So people who have not received their precautionary dose, I think should go ahead and take the precautionary dose. One may debate on this, saying that the current vaccine, we don't know whether that covers the current strain or not, but all the same, I think it will provide some kind of a cross protection, at least to some extent. So we should go and take the vaccination and not deny ourselves that safety measure, which can really be very valuable to some people at times.
Thanks, Dr. Vivek Nangia, for that answer. And thanks, Piali, for calling us as well. So I think those are pertinent questions currently on all minds right now, that whether, what are the distinctions between COVID-19, the symptoms for COVID-19 and the influenza spread that's currently going on? Is it a new wave? Another question that I have is that whether there's a fear of a new variant coming up this time. Dr. Lancelot Pinto is also joining us now, who is a consultant pulmonologist and epidemiologist at Hinduja Hospital. Thanks very much, Doctor, for joining us. And if I can get this question to you, is there a fear of a new COVID variant that could be driving this rise in cases? Or is it Omicron, which, of course, led to the rise in cases in the previous wave?
Hi, and thank you for inviting me. So from what we know from surveillance, the prevailing strain right now seems to be the XBB 1.116 or the XBB 1.16 strain. which is a subvariant of Omicron in itself. So it doesn't look like there has been a major evolution of the virus enough to call it a new strain. And there is no reason to believe right now that this particular strain is more virulent or causes more severe disease than the pre-existing Omicron variants. There is some suggestion that this might be more transmissible, but typically in the history of a virus, we know as viral infections evolve over time, transmissibility might improve, but that doesn't necessarily convert into increased severity of disease caused by the virus. I think that's one thing that we'll need to watch out for very closely in terms of the rates of hospitalization, in terms of the kinds of individuals who are getting hospitalized. Are they high risk or are they low risk individuals who are getting hospitalized? And so far, there have been no major red flags suggesting that this is causing some sort of a severe disease in low risk individuals. So therefore, I think the focus still should remain on high risk individuals. So those who haven't received their precautionary doses should receive it as soon as possible. And there should be some discussion around whether we should offer periodic boosters to individuals who are immunocompromised.
Right, those boosters are extremely important given that many people have not even taken their third dose, considering that cases were falling for the last few months. We have another caller joining us. Kiran Chopra is joining us from Lucknow. Thanks very much for joining us. And what's your question for the doctors?
Yes, good afternoon and hello, doctors. We spoke about the symptomatic aspect of both COVID and the conventional viral that is around. And there is a blurred line between the kind of medication that needs to be administered for the viral as well as for the COVID symptoms in case it is COVID positive. Because some doctors prescribe antibiotics and some ask you just to take standard paracetamol and, control the viral symptoms. So what really is to take in case it is COVID?
Right, I think that's a very pertinent question, given that in the previous waves, we saw that several people were given wrong medications when they had COVID-19. So that's an important question. If Dr. Vivek Nangia, you could explain what's the difference in terms of the medication that people should take between viral and COVID fever? What is the different kinds of medications that people should take?
Right. So basically what we need to understand is that we need to stratify our patients into two groups, the high-risk group and the non-high-risk group. As I said, the high-risk group people would require early identification of the virus, whether it is COVID or influenza, and then be given anti-specific antiviral drugs. There's no role of any antibiotics here. People who have a mild to moderate kind of illness, especially the mild group and with no high-risk group, they don't need to worry about any medication. They should just take symptom-based medication. Like if you have fever, then you take a paracetamol. If you have congestion, then you take some anti-allergics, decongestants. If there is some wheezing in the chest, then you may need to consult your pulmonologist and take some nebulizers or inhalers accordingly. So antivirals are restricted only for people who have a moderate to severe disease or somebody who has a high-risk group. And antibiotic definitely is not needed in this situation.
So that's, of course, important to note, given that several people were given wrong medications that only made matters worse. We also have another caller joining us. Brigadier Dilip Khosla is joining us from Delhi. And Brigadier, I think you're also COVID positive currently. So what's your question, given that you're one of the people that are witnessing this rise in COVID cases and you're yourself a patient currently?
Well, I have a very simple question. I am 72 years old. My wife is 63. And we've both been through both the basic shots and the booster shot. And we have both picked it up again. So is there a worry for people in our group? And do we need to take any special tests to get through this?
Dr. Parekh, if we could take that question to you.
Yes, Brigadier. I'm sure in your career you faced much, much worse in defending our country. At this point, some concern, and I'm sure my colleagues will agree with me that there's not much to worry. But, your question raises something very interesting about this virus or this variant and how it is so different from the other variants we've had in the past. By and large, the variants come out of mutations. So, think of it as a tree and there are different branches and they're just kind of spreading. And two things are happening, Brigadier. One, the virus is becoming progressively weaker, and two, human immunity is increasing. But then comes a variation like this, which is foxy, because it's a recombinant variation. So the strengths of two daughter viruses have combined together. And one study from the University of Beijing and then a study from the University of Tokyo, both showed more or less the same thing, that of all the variants we've seen thus far, the current variant is the most successful in eluding antibodies. So that explains why, despite the vaccination, that's the first part of the question, both of you have been vaccinated, and yet you're infected. On the other hand, as has been amply pointed out earlier, this is not causing severe infections as yet. So if you want to be an optimistic, I would suggest you can take solace in the fact that this is another vaccination for you. And again, studies have pointed out that the immunity that you get after an infection is far superior to that induced by vaccines. So if your symptoms are mild, you are tiding over it, I would suggest that there's no cause to worry. Concern just to monitor yourselves. And once you're well, just assume that you've had your booster all over again.
Right. Brigadier Dilip Khosla, we hope that answered your question. Thanks for joining us on the program. And we also have another caller from Bengaluru. Dilip is joining us from Bengaluru. Dilip, what's your question?
Citizen would be required to take a second booster dose.
Right. So the question, Dr. Pinto, if I can take that question to you, I think what Dilip is asking that they've taken the third dose of COVID-19, the booster dose as we call it, and they're wondering whether more dose should be taken.
So the current evidence based on studies across the world suggests that if you are immunocompetent, that is, you don't have any immunocompromising conditions, if you are young, if you don't have comorbidities, 2 doses plus a booster, in fact, just 2 doses in itself seems to offer an adequate amount of protection against the virus, because the memory cells kick in. Most individuals also have hybrid immunity from the fact that they are vaccinated plus have had COVID at some point of time, which again helps. Now, I think the gray zone is individuals who are immunocompromised, individuals who are elderly, who have comorbidities, in whom periodic boosters might have a role. So if you do fit into that category and you haven't received your precautionary dose, you must receive it. Now, whether you need periodic doses or not will again depend on what risk profile you're at and whether the government takes a policy decision to offer it on a regular basis.
Right. Thanks very much, doctors, for those questions. And another question that I think many of us are wondering right now, that given that COVID cases are rising, we know that while cases were falling for the past few months, the mask mandate had been taken off from across the country, from across states, and people were not taking their precautions. So now that COVID cases are rising, have crossed the 2,000 mark, highest in 5 months, Dr. Nagya, should the mask mandate be brought back? Should masks be made compulsory again to protect people, not just from COVID-19, but also the flu that's spreading currently across the country?
You know, this is something that I have not been able to understand, that why do we need a diktat or some diktat to come so we can actually protect ourselves? You know, this is for your own protection, and this is common sense that the COVID virus is on the rise. If not COVID, the influenza is on the rise. If not influenza, then pollution is on the rise. And all these 3 things can be easily prevented with the help of a mask. An N95 mask is something that I think we should all carry with ourselves. And wear it as soon as you're in public places where there is likelihood of exposure, especially while traveling, especially in conferences, closed doors, meetings. So all of that, you know, this is something which has to come from within. Whether that diktat comes from the above or not, it should not be the criteria for using the mask. We have started using the mask regularly now in our OPDs, in our wards, and even when we are traveling or when we are going for conferences. I think that is what most people should start following from now itself to be able to prevent themselves from this another COVID disaster in the making.
Right. I think the 3 COVID waves that we've seen till now, they for sure teach us that lesson that COVID is not going anytime soon. It's going to live with us. So we need to make masking and these social distancing precautions sort of a habit in our life, because COVID clearly is not gone, and these very simple precautions can help all of us to, be protected from COVID-19, from pollution and from influenza that's also spreading across the country currently. And we also have another viewer now joining us. Vishwa is joining us from Pune, 74-year-old, and his wife is 68-year-old currently. And sir, what's your question for the doctors? Please go ahead.
I just want to know, I have taken a booster dose also. That means total 3 vaccines we have taken. Now, I'm required to travel very shortly by air. Now, is there any specific, other than usage of mask, any specific precaution that I need to take with the current scenario? Because recently I had a flu attack, and of course I'm on way to getting cured.
Dr. Parekh, if we could take that question to you, please.
Yes. In addition to the mask, we also need to involve some of the other COVID measures, the precautionary measures that we took during the earlier waves of the pandemic. You know, one of the things that I think many of us are amazed by is how well our species, the human species, has adapted in this pandemic. I mean, I was amazed at how easily we all adapted to the COVID protocols. We started wearing masks, we started keeping distance, we started washing hands, we started avoiding large gatherings wherever it was possible. And you saw this actually across the world, and certainly we saw a lot of it in our country. I think it's not going to be that much of an extra effort, having done it before, to do it again if you have stopped. I, for one, have not stopped at all through the entire period. Masking now has become second nature for me. Washing hands was always there as a physician, but now, it has more urgent implications, and maintaining distance. And that's about what you can do and should continue to do until such time as everything is behind us.
Right. Thanks very much, doctors, and thanks all our viewers for calling us with those questions. I think it is triggering a lot of questions. But the rising COVID cases are leading to a lot of questions in our minds. Is there a new wave? Is there a new variant? And I think our doctors have clarified those doubts that currently there's no clear yes or no on whether we can call it a new wave. But cases are for sure rising. They're at a 5-month high. And as we have explained here, that we need to make COVID precautions a habit in our lives. We need to keep wearing masks, as they don't just protect us from COVID-19, but they also protect us from influenza, pollution, the dust that's in the atmosphere. So it's always a good habit to wear masks, practice social distancing, just in case, just to avoid any such situation that we've seen in the past few waves in the country, to avoid things getting out of hand and COVID cases rising and hospital admissions rising alongside. This is the time to get our precautions back. Thanks, doctors, for joining us, and thanks to all our viewers as well.